On page N6, it says, item number 8 on page N6, internal anatomy of the heart. And this is a picture of the heart viewed from the back side. We're going to show you a better picture of this in just a moment. I wrote posterior view. Posterior means from the back. And we wrote right here, atrioventricular sulcus. Now, a sulcus is a groove. And we actually use that term sulcus not only for the heart, but also on the surface of the brain. So wherever we have, and you might say, I don't understand what you mean by the word sulcus, I don't understand what a groove is. It's like a valley. Imagine you have hills and valleys. Hills are where the elevation, the land goes up, and a valley is where it goes down. So a sulcus is where it indents. There's an indentation, a furrow, a valley. There is a valley right here that encircles the heart. And in this kind of indentation or furrow or valley is where these blood vessels of the heart primarily encircle. They form a ring around the heart. And the name of this sulcus or groove is the atrioventricular or coronary sulcus. It's called the atrioventricular sulcus because what's above it are the right and left atrium, and what's below it are the ventricles. So this groove or sulcus separates between the upper atria and the lower ventricles. It's known also as the coronary sulcus because the word coronary, as those of you who know Spanish know, corona means crown. Some of us would know that even if we don't know Spanish. We've had a Corona beer, which has a little crown on it. The word corona means crown because when the anatomist looked at these blood vessels encircling the heart, they viewed it like a crown around the head of a king. So that's actually how it gets the name coronary. They form a corona or crown. I always thought one of the most beautiful names of a beach is Corona del Mar, right? Crown of the sea. I just thought that name. But anyhow, so that's in this sulcus, that groove are where these blood vessels are. And so you should know what that sulcus is. If we look on page N7, on N7 at the top, let's look at this picture on N7, and it shows a cutaway view of the heart viewed from the front or anterior side. So let's make a note. This is the anterior or front side. Anterior means front. And I want to remind you that when you're looking at the heart or some part of somebody's body from the front, remember their right is opposite to your right. This is my right hand. It may be on your left side, but you see we're facing in opposite directions. So when you're looking at this cutaway view of the heart, this is the right, thank you, this is the right, and this is the left. Right? So it's the opposite of what you're viewing because you're viewing it from the front. This is your patient's heart. So this is his right and left side of the heart. I want to draw your attention to this wall that separates the right and left sides of the heart. These are the two ventricles, specifically the right ventricle and left ventricle. So we call this wall the interventricular septum. Inter means what? Between. Ventricular means ventricles, and septum, what does septum mean? Wall. Remember a nasal septum? So that is the wall between the two ventricles. Also, just looking at the outer wall of the right ventricle and comparing it with the outer wall of the left ventricle, notice any difference in thickness between the outer wall of the right and the outer wall of the left ventricle. Which one's thicker? The left one by a lot. Why do you think that is? It works harder. Remember, when you make a muscle work harder, it hypertrophies. It becomes bigger and larger and stronger. So since the left ventricle works 6 times harder than the right one, that's why the outer wall of the left ventricle is bigger, thicker, and stronger than the right ventricle. Because the right ventricle, as we know, only has to pump blood through the lungs, whereas the left ventricle has to pump blood through all the systems of the body, all the way from your head down to your feet and back. Now, there's also, this picture doesn't show it, but not only is there a wall between the ventricles, there's also a wall between the atria. And the picture that I think that shows this the best is a picture that we've passed out to you previously. And that's that one-page handout that looked like this. This was kind of the overview. This was a one-page handout we had given to you. And let's just point this out. You can see here, not only does it show a wall between the right and left ventricles, but there's clearly a separation between the right and left atria. I'm going to come back to this picture in just a moment. Just before I do, though, at the very top of N7, so we've already mentioned right here above the picture on N7, the interventricular septum. And I wrote at the very top, interatrial septum. So that's the wall septum between the atria. Now, what's interesting is there's actually a scar, a depression or scar in the interatrial wall. This little scar or depression is called the Fossa Ovalis. We know from when we were learning bones that a foramen is a hole and a fossa is a little depression, a concavity. So there's a little, in an adult, in your heart, there's a scar or depression in the wall between the atria. What's that all about? Well, you see, in a fetus, before you're born, there's a hole in the wall, in the interatrial septum, the wall between the right atrium and left atrium. And that hole is called the Foramen Ovale, the oval-shaped hole. Now, don't confuse this name with the Foramen Ovale in your skull, which is a hole for one of the branches of the trigeminal nerve. But again, it's just describing there's an oval-shaped hole. This hole is in the fetus. That hole was supposed to close at the time of birth, so all that's left is a little depression, a scar called the Fossa Ovalis. Now, sometimes that hole doesn't close, and that's why some of you have heard this expression that some babies are born with a hole in their heart. That's what they're talking about. Now, the question is, what's the purpose of this hole? Why does a fetus have this hole? So let's go back to this picture that shows the overall view of how blood is going through the body. We know that as adults, after we're born, the blood flow and oxygen comes to the right atrium, goes to the right ventricle, and then the right ventricle pumps the blood through the pulmonary circuit, the lungs, to the left pump. But we know that in a fetus, the fetus doesn't get its blood oxygenated by breathing. It's not breathing. It gets its oxygen across the placenta from the mother. So there's no need to really pump this blood through the lungs because the lungs are not breathing, they're not inhaling or exhaling. So there's no need for the blood to flow through there to oxygenate it. So there's actually a hole right here between the right atrium and left atrium in a fetus. So that means that the blood in a fetus can literally flow through this hole from the right atrium directly into the left atrium. It goes through this hole. So if the blood then goes from the right atrium into the left atrium, it bypasses or skips going through the right ventricle and the whole pulmonary circuit. So that's the purpose of that hole, is to allow the blood to skip going through that pulmonary circuit or lungs. Now, of course, at the time the baby is born, when they cut that umbilical cord, there's no more free lunch. Not only is there no free lunch, there's no free oxygen. So at the moment they cut that umbilical cord and that kid takes his first breath, that hole has got to snap shut. And so it normally does. All that's left is a little scar called the Fossa Ovalis. Now, sometimes it doesn't close, or it closes but not completely. And that's when we say a baby is born with a hole in the heart. Now, they will, if it's really wide open, frankly, the baby's going to die because they don't even have time to fix it surgically. Sometimes the hole is mostly closed, not completely, Maybe 80% of the blood is going through the lungs after the baby's born, but 20% is still leaking through this hole that's partially still open. So they may wait a few days, a week, and see if the hole does close on its own. If it doesn't close on its own, then there are specialists, heart surgeons, cardiac surgeons that who are specialized in pediatric cardiac surgery, who will actually do open heart surgery on a newborn baby within the first week or two after it's born. This is extremely difficult work. A newborn baby's heart is smaller than the heart of a chicken. If you've ever seen a chicken heart, it's very small. They've got to put this infant on a heart-lung machine. They have to open up the whole chest, put them on a heart-lung machine, and they have to sew up that hole. But that's what they talk about doing surgery where there's a hole in the heart. So anyhow, you should know what we just talked about. So back on N7, so we have been talking about what the Foramen Ovale is, what its purpose is, and the little scars called the Fossa Ovalis. Now, below the picture, we wrote chambers of the heart. We wrote that the atria are receiving chambers. The blood flowing to the heart goes to the atria, and then the ventricles are the ejection chambers. They're the chambers that powerfully eject the blood. So, as far as the right atrium, we wrote that the right atrium receives blood actually from three veins: a superior vena cava, an inferior vena cava, and a coronary sinus. So let's show you a picture that shows that very nicely. Let's look on page, and I wrote it here, N12. And on page N12, so here's this nice view of the heart. And this is, as I wrote, the posterior view. We have a similar picture on N6, just smaller. All right? So this is the back view. Now let me remind you, we've already said that if you're looking at somebody from the front, their right is the opposite of your right. But if you're looking at them from behind, so that you're both facing the same direction, then their right corresponds with your right. All right? So this is, we're looking at the heart from the posterior to the back side. So in fact, this is the right ventricle here, and this is the left ventricle. It corresponds with your right and left because, again, you're facing the same direction. So this is the right atrium. We wrote it here. This is the right ventricle. This is the left atrium. Wrote it right there. And this is the left ventricle. Now, let's focus on the right pump. So you'll notice you can actually see three blood vessels carrying blood into this right atrium. And what are the three blood vessels bringing blood into the right atrium? First, a superior vena cava. The superior vena cava, which we talked about last week, is bringing blood. Now, vena, it's a vein. Veins carry blood to the heart. Cava is big. It's a big vein. And it's superior, called superior because it's bringing blood to the heart from the upper part of the body, from the head and arms. And this is blood low in oxygen that's coming into this right atrium. Not only is blood coming from the upper part of the body to the right atrium, blood is coming from the lower part of the body through this IVC, this inferior vena cava, into the right atrium. All right? Now, there's a third vein that is bringing blood into the right atrium, low in oxygen, and it's shown right here. It's the coronary sinus. Now, there are some veins in our body that are, because they have a very thin wall, they call them sinuses or venous sinuses. So this is a very thin-walled vein right here. There are some smaller cardiac veins where the blood flows through the cardiac veins into this larger coronary sinus that is located on the back side of the heart. So this is bringing blood low in oxygen from the heart muscle itself, and it is also flowing into the right atrium. So indeed, there are 3 veins that are bringing blood to the right atrium, just as we had written on the bottom of N7. So you can see that. Now, what I wrote next on page N9, on page N9, on N9 we wrote that there is a right atrioventricular, or for short, AV valve, also known as a tricuspid valve. And this is a valve, it's called the atrioventricular AV valve because it's right between the right atrium and right ventricle. I happen to like that term, but the anatomy books call it a tricuspid based on its shape because it's got 3 flaps, 3 folds or flaps. So you might say, well, Professor Fink, which name do you want us to know? And so the correct answer is both. You need to know it's called the tricuspid valve or right AV valve. And the purpose of any valve or sphincter. Valves or sphincters are these structures that ensure one-way flow, so that something only flows in one direction. And so we'll show you a picture of that in a moment. The blood is going to flow past this valve, from the right atrium past this valve, into the right ventricle. The right ventricle is on the front or anterior side. We actually learned that last class meeting, because last class meeting we saw a picture on page N5, and we saw in N5 that when we view the heart from the front, mostly what we see is the right pump, the right atrium and right ventricle, the left atrium and left ventricle are on the back side of the heart. Saw that in N5. So we wrote that the right ventricle is on the anterior or front side, and we described that there are these chordae tendineae. Now, chordae tendineae is Latin for tendon-like cords of fibrous connective tissue that anchor the AV valve cusps or flaps to the papillary muscle in the right ventricle to prevent the valves from turning inside out. And you're probably scratching your head thinking, I don't understand what you're saying. I'm going to show you a picture. The right ventricle is then going to eject blood into the pulmonary artery trunk past a pulmonary valve. The pulmonary valve has made up of 3 so-called semilunar cusps, and therefore it's also known as a semilunar shaped valve, and that prevents the flow of backwards or regurgitation of blood from the pulmonary artery back into the right ventricle. Okay, all I've done is to read what's here, but what does it mean? Let's again look on page N12, and on N12, this time we're going to look at the bottom picture on N12. All right, page N12, the bottom picture. This was the same picture that was on N7, incidentally, same identical picture. And this is an anterior view, a front view. So we know that when we're looking at the anterior view, this is the right, and this is the left, the opposite of where we are. So what I'd like you to notice is here it says right atrium. This is the right atrium right here. And can you see it shows with an arrow, blood is flowing through the superior vena cava, bringing blood from the upper part of the body, the head and arms, into the right atrium. And down here, circled, is the inferior vena cava with the arrow pointing up, showing blood is coming from the lower part of the body into the right atrium. So we can see the 2 big veins bringing blood low in oxygen to the right atrium. This picture does not allow us to see the coronary sinus. All right, so we saw all 3 veins bringing blood to the right atrium in this top picture, but in the bottom picture, which is a cutaway view, we can only see the big superior vena cava and inferior vena cava. But there's also that coronary sinus. Now, the reason why I had said right below the picture, below on N7, we had said that the atria are the receiving chambers and the ventricles are the ejection chambers. By receiving chambers, we mean that the atria receive the blood. The blood flows into the atrium, but it's going to be the ventricles that powerfully eject the blood. But anyhow, you'll notice this right here is labeled the tricuspid valve, or right AV valve. All right, this is the valve between the right atrium and the right ventricle. It's called tricuspid because it's made up of 3 flaps. It's also known as the right atrioventricular valve because it's the valve between the right atrium and right ventricle. And what holds those flaps in place are these fibrous connective tissue tendon-like bands called chordae tendineae, which literally means tendon-like cords. And these tendon-like cords are attached or anchored to muscle on the inside wall of the right ventricle labeled papillary muscle. This is exactly what we were just reading to you on page N9. So we're just describing it. Now the blood flows from the right atrium past this valve into the right ventricle. Again, what's the purpose of the valve? To prevent the blood from going backwards. And then the right ventricle is going to eject, right? The ventricles are the ejection chambers. It ejects the blood up into the pulmonary artery trunk. This is what's labeled here, the pulmonary artery trunk. Notice there's another valve right between the right ventricle and the pulmonary artery trunk. This valve is labeled the pulmonary valve. And because of its shape, since it's said to be made up of 3 semilunar cusps or flaps, it's also known as a semilunar shaped valve. All right, so that's the valve between the right ventricle and the pulmonary artery trunk. The right AV valve and left AV valve are not the semilunar. They're designed a little bit differently. Let's see if we can show you a flow chart that kind of summarizes this. So let's take a look at page, all right, this is page 017. Now your lab manual, as well as the textbook, has many flow charts. But here's what I've tried to do. So here on 017, we've tried to show in a kind of flow chart way with arrows. There are 3 veins bringing blood to the right atrium. The superior vena cava bringing blood from the upper part of the body to the right atrium, the inferior vena cava bringing blood from the lower part of the body, and the coronary sinus bringing blood from the heart muscle itself. It comes into the right atrium, and then the blood goes into the right ventricle. And what's the name of the valve right between them? It's called the right AV valve or tricuspid valve. The right ventricle is then going to eject the blood out into the pulmonary artery trunk. But there's a valve right between the right ventricle and the pulmonary artery trunk. We call that the pulmonary valve. It is said to be a semilunar shaped valve. Does everybody see how that kind of summarizes exactly what's happening here? Now, as this blood goes out, is ejected out of the pulmonary artery trunk, what does it do? The pulmonary artery trunk bifurcates. Now that's a word we're going to use a lot. I think we introduced it to you previously. It means to divide into 2, like a bicycle has 2 wheels. So the pulmonary artery trunk divides into a right pulmonary artery and a left pulmonary artery. You'd say, why is that? Because you have a right lung and a left lung. And so the right pulmonary artery is carrying blood to the right lung, and the left pulmonary artery is carrying blood to the left lung. Now, of course, the whole reason why you're sending the blood to the lungs is to gain oxygen and get rid of CO2. That's the whole purpose of what the right pump's job is to pump the blood through this so-called pulmonary circuit, which is what we call this at the very top, and oxygenate the blood. Now, as the blood becomes oxygenated, it's now going to flow back to the left pump, specifically to the left atrium of the left pump. The atria are the receiving chambers. They receive the blood, then the ventricles eject it. In fact, there's actually 2 veins from each lung that are bringing oxygenated blood to the left atrium. 2 from the right pulmonary, so there are 2 right pulmonary veins and 2 left pulmonary veins, or 4 pulmonary veins bring oxygenated blood to the left atrium. Now, even though we've learned that arteries are usually high in oxygen and veins are usually low, that's not the definition of an artery or vein. And in fact, the pulmonary arteries are low in oxygen, the pulmonary veins are high in oxygen. Because the definition of an artery and a vein, arteries carry blood away from the heart and veins carry blood to the heart. But, so just make sure you don't mix this one up. Again, most of the time, if you're dealing with an artery and you were to guess that it's high in oxygen, most of the time you'd be right. But not here. Not for the pulmonary arteries and veins. They're the reverse. All right, so let's see if we can show you a picture where these 4 pulmonary veins are bringing oxygenated blood to the left atrium. Let's go back to page N12. And on N12, in the top picture on N12. So in this top picture, this is a posterior view, a view from the back side of the heart. So we know it's like viewing me from my backside. We're both facing the same direction. This is the right pump. This is the left pump. This is the left atrium right here. Can you see the 4 pulmonary veins? Here it shows 2 left pulmonary veins bringing blood, oxygenated blood, into the left atrium, and 2 right pulmonary veins bringing oxygenated blood into the left atrium. 4 pulmonary veins, 2 from each lung, are bringing oxygenated blood into the left atrium. And then this oxygenated blood is going to go from the left atrium down to the left ventricle. So, in fact, let's show you that by looking at the bottom picture. Okay, now in the bottom picture, this is an anterior view, a front view. So right and left is the opposite of your right and left. So here's the left atrium. Can you see 4 arrows? Those 4 arrows represent the 4 pulmonary veins bringing oxygenated blood to the left atrium. This oxygenated blood is going to go from the left atrium down into the left ventricle. Left ventricle, it says it right here. There is a valve that controls the flow of blood between the left atrium and left ventricle. It actually goes by 3 names. And unfortunately, you have to learn all 3 names. We had mentioned this previously. The anatomy books call it the bicuspid valve because anatomy is mostly interested in structure or shape, and it's got 2 flaps, in contrast to the tricuspid valve on the right side. The physiologists like to call it the left AV valve. I'm a physiologist, I happen to like that name, but because that's the valve between the left atrium and left ventricle, left atrioventricular valve, AV valve. But most clinicians, most doctors call it the mitral valve for no reason whatsoever. All right, so you have to know all 3 names. So the oxygenated blood is going to go down to the left ventricle. Again, notice what's holding the flaps of the bicuspid valve, just like what was holding the tricuspid valve, are the chordae tendineae. These are the chordae tendineae, again, that are anchored into muscle inside the left ventricle. Now, the left ventricle is going to eject the blood out up into here, into the aorta. Now, you might say, well, I don't see the connection. That's because the whole front of the heart has been cut away. So we're just looking at the back half. So the actual connection from the left ventricle to the aorta here has been cut off. But it ejects up into the aorta, and notice this aortic valve is right here. The shape of the aortic valve is very similar to the shape of the pulmonary valve. They are both said to be semi-lunar shaped valves. All right, so the oxygenated blood is going to be ejected by the ventricle, the left ventricle. These are the ejection chambers up into the aorta. So you might say, Professor Fink, you know, you showed us that flow chart on 017. That was so good. Do you have another one for this other side of the heart? Yes, it's on page 01. So let's take a look at page 01. And on page 01, so here's what we wrote for on 01. Again, the idea of a flow chart is to just kind of follow in line what's going on. So the oxygenated blood goes from the left atrium into the left ventricle. And there's a valve between the left atrium and left ventricle. It's called the bicuspid valve by anatomists. It's called the left AV valve by physiologists. And it's also commonly called the mitral valve for no reason whatsoever by most clinicians. The left ventricle ejects the blood out into the aorta, the biggest blood vessel in the whole body. And there is a valve between the left ventricle and the aorta called the aortic valve, a semi-lunar shaped valve. Now incidentally, before I go any further, all of this was summarized on pages, again, N9 and N10. Let's look at N9. So on N9, we wrote that the left atrium receives blood from 4 pulmonary veins. Again, all this is redundant. If you're thinking, aren't you saying the same thing over and over? Yes. All right. So, we've mentioned this left AV valve or bicuspid valve or mitral valve. And the purpose of a valve is to prevent something from going backwards. Regurgitating means going backwards. And on page N10, the left ventricle, we remind you, is on the back or posterior side, just as the right one is on the front or anterior side. Again, the chordate tendonae anchor the AV valve cusps to muscle inside the left ventricle to prevent the valve from inverting. And the left ventricle ejects the blood out into the aorta past that aortic valve. Incidentally, the picture at the very top of N10 shows the appearance of these valves. You can see why the bicuspid valve is called bicuspid. It's got 2 flaps. That's the left AV valve. You can see why the tricuspid is called tricuspid. It's got 3 flaps, the right AV valve. And the pulmonary and aortic valve, which also have 3 flaps, incidentally, in case you're wondering, but they are shaped a little bit differently, and they look almost identical, kind of like a peace symbol there. And they look almost identical. They are both called semi-lunar shaped valves, the pulmonary and aortic. And they're organized a little bit differently than the right and left AV valves. Okay, now that we've described how blood is flowing through the heart, and incidentally, the best diagram that I think that summarizes this very simplistically is on the back side of this one-page handout. We looked at this last class meeting, this diagram. Remember this? And this is a schematic diagram, just to repeat what we've just learned. So here it shows the blood's flowing from the vena cava and the coronary sinus into the right atrium. It goes from the right atrium past the right AV valve or tricuspid valve into the right ventricle, from the right ventricle past the pulmonary valve into the pulmonary artery. This is blood low in oxygen. There it gains oxygen, gets rid of CO2. Now this oxygenated blood flows through the pulmonary veins to Los Angeles, well really the left atrium. And there it goes from the oxygenated blood, goes from the left atrium, past the left AV valve, also called the bicuspid, also called the mitral valve, into the left ventricle. And the left ventricle ejects the blood out into the aorta, the largest blood vessel in the whole body. And we know that there are many, many smaller arteries that branch off that huge aorta because, you see, this is called the systemic circuit. The systemic circuit, because this is branching off the aorta, about 100 smaller arteries that are carrying blood to every system of the body, as opposed to the very top, which was just the pulmonary circuit, the lungs. So, in fact, according to this schematic diagram, the very first little arteries that branch off the aorta are the coronary arteries, which are the arteries that supply oxygenated blood to the heart muscle itself. Let's take a look at page 05. Page 05. And on page 05, what we're looking at on page 05 is the aorta. The aorta is this thing right here. This whole big thing is the aorta. It's the biggest blood vessel in the entire body. It's huge. And we said there's about 100 smaller arteries branching off it. Now don't worry, we're not going to ask you to know all 100 little arteries branching off it, but we are going to learn some of them. So first off, because the aorta is so big and so long, we give it different names along its length. Now the first part of the aorta, this is where the blood is being ejected upwards through the aorta. Just follow these arrows. And because of that, it is called the ascending aorta. What does ascending mean? To go up. You might remember we called that part of the colon or large intestine that goes upward the ascending colon. And then the aorta kind of bends. It forms like an arch. And because of that, we call that the aortic arch, right where it bends. And then the blood starts to go downwards through the aorta as it travels through the chest. And so since the blood is going downwards through the thorax or chest, it's called the thoracic aorta. And then this thing right here, you'd say, yeah, what's this? This is the diaphragm muscle. It says that right here. The diaphragm muscle. And so as the aorta goes through, actually it goes through a hole. There's a hole in the diaphragm muscle. The name of the hole is the aortic hiatus. A hiatus means an opening. So there is a hole in the diaphragm muscle that the aorta goes through, and once it goes through the diaphragm muscle, that hole, now it's in the abdomen. So now we call it the abdominal aorta. Call it the abdominal aorta. So again, to repeat, we have the ascending aorta, the aortic arch, the thoracic aorta, and the abdominal aorta. And the way that the aorta terminates is it terminates by dividing into two branches. It bifurcates into a right and left iliac artery. A right and left iliac artery. And the iliac arteries carry blood down to the legs. So that's how it kind of finishes, by dividing into a right and left branch. So what we want to do is to mention some of the more important of the smaller arteries that branch off the aorta. And you'll notice, just to look at the picture, the very first little arteries branching off at the very beginning of the aorta, branching off at the beginning of the ascending aorta, are the right coronary artery and the left coronary artery. These are the right and left coronary arteries. Remember, you'd say, why are those important? Why are you making us learn those? Because we've learned that a blockage, an obstruction of the flow of oxygenated blood through the coronary arteries, that's the cause of a heart attack. So if you don't think heart attacks are important to know about, then don't worry about it. It's just that the heart attacks are the #1 cause of death.
But that's the only way you're going to have a heart attack?
We're going to learn more about it. There's more to say. But that's basically what it is a blockage of blood flow through the coronary arteries to the heart. Now, those are the important little arteries that branch off the ascending aorta. Now, where the aorta bends or forms an arch, in us humans, there are 3 arteries that branch off the aortic arch. You can see them. Here's the first one, number 1, number 2, and number 3. Those are the 3 arteries. The first one is called the Brachiocephalic Artery. And the brachiocephalic, let's think about what the word means. Brachiocephalic means arm head, the arm head artery. Some of you might say, well, you never told us brachio means arm. Well, what's biceps brachii mean? The muscle in the upper arm. All right, and cephalic means head. Where we learned all these terms is back on page A6. You can check it, it's there. All right, so the arm head artery, and then the reason why it's called arm head is it bifurcates. We use that word bifurcate a lot. It bifurcates. It divides into 2, into a right subclavian artery and a right common carotid. The right subclavian is called that because it's going to run under the clavicle, your collarbone, to your right arm. So this is carrying blood to the right arm. This is going to the right arm. The right common carotid is going to carry oxygenated blood up to your right side of your head. So this is going up to the head, the carotids. Now, the second artery that branches off the aortic arch is called the left common carotid. So it carries blood up, oxygenated blood to the left side of your head. And the third artery that branches off the aortic arch is the left subclavian, which is carrying oxygenated blood to the left arm. Right, so this is going to the left arm. This is going up to the head again. Now, of course, an obvious question we might have is, well, why was this a brachiocephalic and then it bifurcated? And here, wasn't a brachiocephalic. It didn't have to bifurcate. The simple answer is because God made it that way. All right? Probably it's that slight difference because of embryology, of the way it forms. All right? But that's the way it is. All right? So, but after it bifurcates, we're identical. We've got a right subclavian carrying oxygenated blood to the right arm, left subclavian carrying oxygenated blood to the left arm, and a right-left common carotid carrying oxygenated blood up to the head.
Is it the same on the cat?
It's slightly different, as we'll see. Most of everything else is the same on the cat. Now, you can see there are other arteries, smaller arteries, branching off the thoracic aorta, including bronchial arteries, supplying oxygenated blood to our airways. Because even our tubes, the airways, need their own oxygenated blood. Esophageal arteries, supplying oxygenated blood to our esophagus. Intercostal arteries, supplying oxygenated blood to the muscles between our ribs. Intercostal, between the ribs. Let's summarize some of these arteries coming off the thoracic part of the aorta by looking at the previous page, 04. So if we look on page 04, so on 04, it's entitled at the top, Thoracic Aorta and Abdominal Aorta. And here, it shows thoracic aorta, bracketed. What are some of the arteries branching off the thoracic aorta? And I would like you to know those that are underlined. Intercostal arteries, supplying intercostal muscles. You will see these on the cat. We've asked you to find them. The bronchial arteries, supplying oxygenated blood to the airways of the lungs. Esophageal arteries, supplying oxygenated blood to the esophagus. And the phrenic arteries supply oxygenated blood to the diaphragm muscle itself. Now, of these arteries that we've mentioned here, the only ones you're going to see on the cat are the intercostals. The bronchial arteries and esophageal arteries and phrenic arteries usually don't show up well enough. So in other words, just know that they exist, but you're not going to see them on the cat. You will see the thoracic aorta and the intercostal arteries. Then we mentioned that this aorta goes through this aortic hiatus, this opening in the diaphragm muscle. And then we've listed a bunch of arteries that branch off the abdominal aorta. And you'll notice that among the arteries branching off the abdominal aorta are the celiac artery. Now, incidentally, the way celiac is usually spelled in our books today is without the O. It's missing the O. It's celiac. However, that only changed not that many years ago. And in fact, in Britain, you will still see the celiac written O-E. That's how it was spelled. But, you know, American English tends to make it simpler than British English, the spelling. So, anyhow, so celiac artery, and we've mentioned celiac previously. You'll notice also branching off, the celiac branches off the abdominal aorta. The superior mesenteric artery branches off the abdominal aorta. The renal artery branches off the abdominal aorta. The inferior mesenteric artery branches off the abdominal aorta. Let me just remind you of this. In this picture of our overall view, do you remember us mentioning there were 3 arteries that branched off the aorta, supplying oxygenated blood to the digestive tract, branching off the aorta, the celiac artery, the superior mesenteric artery, and the inferior mesenteric artery, and here it shows the renal artery going to the kidneys. So we had mentioned these last week. these very important arteries that supply oxygenated blood to these organs of your body. So you'll notice also we've indicated that branching off the celiac is a gastric artery that carries oxygenated blood to the stomach, and a splenic artery branching off the celiac that carries oxygenated blood to the spleen. There's also a hepatic artery that carries oxygenated blood to the liver. Most of these we've asked you to find on the cat. We've asked you to find them on the cat. You should be able to see them. Now this sounds more complicated than it is. It's really, really, truly simple. I know that as you listen to me, you're thinking it doesn't seem simple, but if you see on the cat a red-colored vessel, and we know they are color-coded for you. The red vessels are arteries, the blue ones are veins. In real life, they do not come in red and blue. They're all white. But for the purposes of us learning on the cat, the arteries are red and the veins are blue. And if you're wondering what about the pulmonaries, they're not injected, so you don't have to see them on the cat. But so if you see a small red vessel going to a stomach, since it's red, you know it's an artery, and since it goes to a stomach, you know it's called the gastric artery, because gastric means stomach. It's pretty simple. If you see a red vessel going to a spleen, what would you call it? A splenic artery. If you see a red vessel going to a kidney, what are you going to call it? A renal artery. It's very simple. If it's red, it's an artery on the cat, and you just name it based on what organ is it going to. That's what it's carrying oxygenated blood to. So it's really very straightforward. All right. Now, the ones, again, that I'm asking you to know are those that are underlined. You'll notice I did not underline adrenal artery. I do want you to see the adrenal vein on the cat. You'll see that. But we haven't gotten to the veins yet. And I have not underlined testicular or ovarian arteries. It's not like these are unimportant. Those are the blood vessels that carry oxygenated blood to the testes or the ovaries. But I didn't underline them, so I won't test you on them, either on the cat or anywhere else. So, but again, it's not that they're irrelevant. The lumbar arteries we've asked you to find on the cat. They supply the muscles of the lower back. And then we have the iliac arteries. The way the picture on page 05 shows this, it's like a big mess. You can see all these arteries branching off the abdominal aorta. Now again, the best way to learn these is by looking at the cat. That's just like, how did we learn the muscles? What really helped us learn muscles is when we saw them on the cat. And when you heard me talk about them, it seemed really complicated, and then you saw them, and you pulled on it, and it made it seem a lot easier. And same thing will be true here. Now, how does the abdominal aorta terminate? It terminates by bifurcating into a right and left iliac artery. Let's show you that by looking at page 07. On 07, so here's page 07. So let's just see how the aorta ends. Here's the abdominal aorta. It says that right here. And it shows the abdominal aorta bifurcating, dividing. And there's a common iliac, and then it bifurcates, forming an external iliac and an internal iliac. And you go, oh my gosh. The internal iliac is carrying oxygenated blood to the pelvic organs, to the pelvis, and all the organs in the pelvis. The external iliac is traveling down the leg. And in fact, if we follow the external iliac, once it reaches around the middle of the thigh, its name changes to the femoral artery. All right, so it's called the external iliac, and then when it reaches around the middle of the thigh, we change its name. We call it the femoral or femoral artery. Now, you can see that obviously that femoral artery continues downwards to the lower leg, but I'm not going to test you on all this other junk. I could, but I'm not. Let's look on the previous page, 06. So on 06, There is the common iliac artery, and you could underline that, forgot to. And then we said there's an internal iliac and an external iliac. The internal iliac artery, we said, carries oxygenated blood to the pelvic organs. And that includes the rectum, the urinary bladder, the uterus, the genitalia, all of those structures in the pelvic area. Those are all pretty important. And the external iliac, when it reaches the middle of the thigh, its name changes and becomes the femoral artery. Now, those are the only vessels that I've underlined on this page. So we could test you on all these other blood vessels of the legs, but I just want you to know these. So there's that. Let's go back to page 01. Page 01. And on page 01, I'm going to walk through this in a little bit more detail. So we'll remind you on the top of 01, we have learned that the left ventricle ejects the blood out into the aorta. And the very first part of the aorta is called the ascending aorta. Goes up. And here we remind you, what are the two important little arteries that branch off at the very beginning of the ascending aorta? The right and left coronary arteries that supply oxygenated blood to the heart muscle itself, the myocardium of the heart. And then the ascending aorta bends, it forms an aortic arch, it arches. And here we wrote aortic arch, and I showed 3 vessels branching off the aortic arch. 1, 2, 3. The first is the brachiocephalic, the arm-head artery, and what does it do? It bifurcates into a right common carotid artery and a right subclavian. The right common carotid is carrying oxygenated blood to the right side of the head, and the right subclavian is carrying oxygenated blood to the right arm. The second artery branching off the aortic arch is the left common carotid, and it carries oxygenated blood to the left side of the head. And the third artery branching off the aortic arch is the left subclavian carrying oxygenated blood to the left arm. We'd already shown you pictures of this. In fact, let's just show you another picture. Let's just show you another picture of those 3 arteries branching off the aortic arch. Let's again look at page N12. N12. And on page N12, on the bottom picture of N12, here's the bottom picture of N12. Incidentally, N7 is the same thing. Here's the aortic arch, right? This is the ascending aorta. Here's where it's arching, it's bending, aortic arch. Can you see 1, 2, 3? The 3 arteries that branch off the aortic arch. And the first one is labeled brachiocephalic, the second, the left common carotid, the third, left subclavian. Now you might say, are these really important to know? Only if you think understanding how oxygenated blood goes to your arms or to your head is important. If it's not, now incidentally, if there's any blockage of oxygenated blood to your head, that's the cause of strokes. Right? So if you don't think that's important to know, then it's not important. Although strokes are the 3rd leading cause of death. Right? So this is all important. All right, so that's a picture that shows this. Let's go back to 01. And on the bottom of 01, bottom of page 01, now, the common carotid arteries are carrying oxygenated blood up to the head. But they actually bifurcate on the way up. Going up your neck, they divide and form an external carotid that supplies oxygenated blood to your face. And if we look on page 03, on page 03 at the top, it says internal carotid. And the internal carotid artery passes up the carotid canal and the temporal bone, bringing oxygenated blood to the brain. Let's show you a picture of that. Let's look on page 02, the previous page. And we're going to look, this is page 02. We're going to look at the bottom picture on 02. The bottom picture, I'm going to flip this around. So we're looking at 02 on the bottom picture. Now you might say, you know, Professor Fink, this would be a lot better if this was in color, you know, and all nice to see. It is. It's in your lab manual. This is figure, in your lab manual, figure 24.3. Does that look like what I'm talking about right now? This is figure 24.3. All right, so if you'd like to see it all nice in color, it's figure 24.3. Incidentally, I'm going to be showing you some flow charts. Here's the flow charts in your lab manual. This is figure 24.2. Okay, but let's look on page 02. Yes, I'd like to begin right here where it says Brachiocephalic Artery. That's the arm-head artery. And what does it show the arm-head Brachiocephalic Artery doing? It bifurcates, to use my word. It divides into two. This branch goes up the neck. This branch is heading under the clavicle. This is the clavicle right here. It's going to go into the clavicle to the arm. All right? So in fact, the branch going to the arm is called the subclavian because it runs under the clavicle. And it's on its way to the arm. The branch that's going up the neck is called the right common carotid. Follow the right common carotid artery up. Right? It's going up, and look what it does. It bifurcates. And it forms an external and an internal. Right? The external carotid is going to the face, and the internal is going up to the brain, which is what I wrote right here. Now, people going into dentistry and dental hygiene are going to have in the first semester of their program head and neck anatomy. And they're going to go into a lot more detail as far as the blood supply of the face. Now, the internal carotid is going up, and it's going to go through the carotid canal and come out into the skull, the cranial cavity, and supply oxygenated blood to the brain. That's the internal carotid. Now, you'll notice, staying on this picture for a moment, that this is the subclavian artery. And it's going to be carrying oxygenated blood to the arm. To the arm. This is going to the arm. But in fact, the very first branch off this subclavian artery is called the vertebral artery. And you'd say, is that supposed to mean anything to me? Yes. The vertebral artery is going along the cervical vertebrae. And in fact, we learn the way we can recognize a cervical vertebra from any other vertebra is it's got those holes in the transverse processes. Those holes were called transverse foramen. And the purpose of them was for the vertebral arteries to go up them. And those vertebral arteries travel up the cervical vertebrae. Then they go through the foramen magnum, the big hole at the base of the skull. And then the right and left vertebral arteries join together to form a basilar artery that also brings oxygenated blood to the brain. So there's really two passageways for oxygenated blood to go up to the brain. You'd say, what do you mean two? There's the internal carotid arteries that are bringing blood here up to the brain. And there are the vertebral arteries that branched actually off the subclavian. Now you might say, you know, this is just too much. You're throwing out too much new stuff at us. The only problem is none of this is new. I'd like to have us go back to section E. And back on section E, page E17. E17. And you will even notice that on E17, this picture at the bottom, you already have colored in. You've already got notes on it. And what is it showing? Exactly what I've just reviewed with you. These are the two arteries bringing oxygenated blood to the brain. There is the ICA, the internal carotid artery. Notice how it branched off. Here's the common carotid. It bifurcated into an external carotid artery, ECA, and an IC, an internal carotid artery. That goes up through the carotid canal and comes out through the foramen lacerum to supply oxygenated blood to the brain. And here, branching off the subclavian artery, SCA, is the VA, not Veterans Administration, but the vertebral artery, and it goes up through the foramen magnum, where it becomes known as the BA, the basilar artery, and that's bringing oxygenated blood to the brain as well. And in fact, we summarize there are two pairs of arteries that supply blood to the brain, the right and left internal carotid arteries and the right and left vertebral arteries, which we mentioned back on page E17 for the first exam. So this is not the first time we've mentioned it, but we're just reviewing it. Look, I understand it's hard to remember all this stuff.